part 3 of what do I use for sore nipples or painful nipples when breastfeeding. I am Cindy Rubin. I am a breastfeeding medicine specialist and lactation consultant and 4th trimester doc and pediatrician in the Chicagoland area. So there sometimes can be wounds that are just very stingy no matter what you use. We use moist closed wound healing to heal visible or present wounds. And sometimes there can be wounds on the surface of the nipple, there can be wounds at the base of the nipple, there can be wounds kind of anywhere that there may have been damage from the breastfeeding. Number one, we always go back to that latch. We want to make sure that the latch is deep, wide mouth, comfortable. But even once the baby's latching okay, if there's already damage, it may be difficult to get that damage to resolve. So if number 1 and number 2 items in my part 1 and part 2, the nipple balm and parchment paper or hydrogel pads are not leading to healing over time, then you may need something more. And if that's going on, I would reach out to a breastfeeding medicine specialist who can help you with that healing. There are Nursicare pads, which are fantastic for these deeper wounds, and you just want to kind of fold the nipple so that the area of the nipple that does have an open wound is exposed to the Nursicare pad. Nursicare pads are made out of a substance called polymem, and you can actually just buy polymem and cut it out and use that. There's also something called Mepiplex, which is very similar, that can also be used in these deeper wounds, especially when the wound is kind of letting off some wetness of its own and is very moist and goopy. These kinds of pads are going to work well. But it's also very important to work with a physician as you're doing this to monitor the healing and give some other tips as you go along. So hopefully this is helpful. In part 4, we are going to talk about some things not to do if you have sore nipples.